Hello, Dr. Keith Smith with you from the Surgery Center of Oklahoma. Thank you for including me in your summit. I'm honored to be here, but I also come to you with great humility because all we've really done at the Surgery Center of Oklahoma by putting our prices online is say, here's what we do and here's how much it is. This is no different than any other industry in the United States. Everyone has to do this. They have to display their value, and that is what we've done. And I believe I will make the case, and hopefully I will, for many of you, and you'll feel challenged to at least give what we've done some consideration and find the draw of embracing the discipline and principles of the free market as compelling as we have. I'll tell you a little bit about our story and how this got started, where we got these ideas, and what the results have been. I will tease you a bit, though, that there is not a single person who works at the Surgery Center of Oklahoma, myself included, that it could be more excited about the practice of medicine than they are right now. We are all very optimistic, and this facility, for having embraced the market, is experiencing an alarming growth and wild success. Let's talk about how we got here. I started practice in 1990 in Oklahoma City with the idea that I would do primarily cardiac anesthesia. I was very busy, and in 1992, what I call the Rosemary's Baby of healthcare, the resource-based relative value scale, was birthed by Harvard University with the idea that some central planning bureaucrat knew exactly how much an anesthesiologist should be paid for an open heart anesthetic. Prior to the birth of this disaster, I was paid about $1,100 for the average open heart surgery for my anesthetic component. After RBS came out, I was paid about half that, about $500 for a typical anesthetic for an open heart surgery. This was alarming to me, and it got me reading. It got me studying about economics. It got me thinking about many things that I really, up to that point, really wasn't even motivated to understand. 1 year later, they did it again. They cut it in half. And the last anesthetic I provided for an open heart surgery, which was about 6 hours and very difficult case, I was paid $285. At that time, I realized these are just signals. I had read enough economics to know this was not personal. The folks in Washington, D.C., the folks at Harvard, they didn't know who I was. This wasn't personal. They were just sending a signal. Their signal was, this is what we think 6 hours of your time doing an open heart anesthetic is worth. I felt obligated to return an appropriate signal. By continuing to do the cases, by continuing to participate in Medicare, I would be sending what I believe to be a faulty signal. So I quit. I quit dealing with the federal government altogether. I quit accepting Medicare. I provided anesthetics to Medicare patients free of charge. To deal with the government and to take this money, for me, it just provided legitimacy to them, which was completely undeserved. I'd also come to see that the government didn't have any money, and that by accepting Medicare money, I really was taking money out of the wallet of my next door neighbor for care I rendered to someone across town he didn't even know, also who could likely afford my services when my neighbor maybe couldn't. That's my story with Medicare. It was the most liberating act of my practice at the time. I have to give Dr. Jane Orient and the Association of American Physicians and Surgeons all the credit in the world for me walking away from Medicare. It's a great decision, and it is something I would encourage you all to investigate. The Clinton healthcare plan was the great scare in the early 90s, for any of you who are too young to remember, that allowed the hospitals to become abusive, I believe, with the surgeons and with the physicians who worked at the hospitals. The hospital administrators that I know, they capitalized on the fear that was created by the resource-based relative value scale, along with the possibility of the Clinton healthcare plan. Physicians and surgeons signed contracts with insurance carriers they otherwise would never have signed had this fear not been present. I watched the hospital administrations where I worked bully physicians and get away with it because the physicians were so afraid that if they did not participate in these scams that they would be ruined and that they would be completely shut out. I also watched the hospital charges at the hospitals where I worked go way up while they simultaneously cut back on the nursing staff in the operating rooms and on the floor. The staff that was not cut back on, of course, was the administrative staff. That staff seemed to grow at an alarming pace. I also saw the care at the hospitals really decline. And surgeons that were really good surgeons tended to leave, and really bad ones kind of took their place. Dr. Stephen Lantier is also an anesthesiologist and the co-founder of the Surgery Center of Oklahoma with me. We were business partners at the time. We had many discussions late in the night about this and what to do. We felt terrible. We felt like we were accessories to a crime many times when we participated in a patient's care at some of these hospitals. We decided we had to get out. So in 1997, we started the Surgery Center of Oklahoma. We decided we would settle for nothing but the highest standards of care. We'd never accept a dime of government money, and that we would be honest in our pricing, that we would embrace the discipline and the principles of the free market that we had increasingly that we were increasingly understanding. We started this entity in 1997 and were very successful early on. It was a group of 10 surgeons and Dr. Lantier and I, and today over 60 surgeons work at our facility that's over 40,000 square feet, and it is a wild success. It was a wild success in the beginning, and it's a wild and alarmingly growing success now. But it's not always been like that. About 6 years after we started, the insurance companies, they stumbled on a scheme that helped them out, and along with their pals at the hospitals, that denied access to our facility to many of the people who were supposed beneficiaries of their insurance policies. They started stacking deductibles on patients. This made it almost impossible for anyone that had insurance to come through our doors and have whatever procedure they required done here. It didn't make sense. I knew our quality was as good or better than anyone's here in the region. I mean, we put our prices online. We operate on almost all of the Division I athletes in this area. Dr. Lantier and I and two other anesthesiologists we do a lot of pediatric anesthesia, and we have great results. There was no reason for us to not be busy. We knew we were quality-wise meeting the bar, and price-wise we knew nobody even came close. In a free market, if you are delivering this kind of a value, you should have a line out the door. Instead, we saw the patient numbers at our facility dwindle really to a point where we really were having to sharpen our pencils and think about our business in a way we didn't really want to. I decided that we needed to put our prices out for everyone to see. We needed to do this for several reasons. One, many uninsured patients knew about the Surgery Center of Oklahoma, not just here in Oklahoma City, but in this area. I wanted more of them to know about us so that we could spare them the bankrupting charges that they would experience at some of these so-called not-for-profit hospitals. I also wanted more patients who had health savings accounts know about us, because these are people who have the sticker shock. They're actually buying their health care out of their pocket. I also wanted to appeal to anyone else that really was buying health care that had the sticker shock. And it turns out this was the self-funded community. Businesses that do not buy insurance but rather self-insure. They pay for their employees' healthcare needs out of operational expenses. These people love what we're doing, and there is a lot of business that comes to the Surgery Center from all over the United States from companies that are self-funded. We put these prices online, not understanding why we weren't busy, but knowing that something was terribly wrong. What resulted was we got a lot busier, but we also were uniquely positioned as physicians and as facility owners to begin to understand the way that the healthcare scam really works. It was shocking to us to realize that the insurance carriers didn't like us because our prices were so low and because our quality was so high. The carriers actually make more money when the claims that they receive from these hospitals are very high because they charge to the extent that they discount these claims. They charge for discounts. This is a common activity on Wall Street and many other places, but most people don't think that an insurance company actually wants to be charged $100 for an aspirin instead of not charged at all, which is the case here. These scams became more and more apparent to us as time went by. It's also given us, I think, a unique lens to view the Unaffordable Care Act because there's nothing in this transformational disaster of a bill that addresses any of the scams that we've seen, like repricing of claims, like uncompensated care. You know, the hospitals basically work like a reverse Enron. The more that they claim that they lost, the bigger kickback that they get from the federal government in the form of these disproportionate share hospital payments. That's why these emergency rooms that are supposedly breaking their backs with all the uninsured all have a crane in front of them building on. The hospitals need all of that red ink to maintain the fiction of their not-for-profit status and also to maximize their uncompensated care kickback. These are the kinds of things that we began to understand just from having put our prices online. The insurance carriers had a lot of explaining to do when a business owner would say, "Why in the world is the Surgery Center of Oklahoma not in your network? You really need to get them in your network. I mean, that's a great place. I mean, my child had their tonsils taken out there. The care was second to none, and their prices are really low. Look here, look at their prices online." The carriers had a very, very difficult time with this, and they still don't deal with us, which is fine with me. I've canceled every contract that we have with third parties except for one, and I hope it's gone by the end of this year. At the rate that we're growing, I believe it will be gone. So we put the prices online, and the first patients who arrived were Canadians. This is yet another example, and I think a very wild example of why single payer is a disaster, and the Unaffordable Care Act is a disaster. After all, the push in the Unaffordable Care Act is for everyone to have coverage. It has nothing to do with cost or with care. It is all about mandating coverage. This, of course, lines the pockets of those who are selling the coverage, and it lines the pockets of those who are filing claims against that coverage. In Canada, everybody has coverage. They just don't have very good access to care. And that people travel to Oklahoma City to have their surgery from Nova Scotia and Winnipeg and Vancouver is evidence that coverage is not the answer. Really, cost is what needs to be addressed because that is what allows you to ascertain value. We have had a huge response from Canadians, from the uninsured in this area, and from people that have health savings accounts and high deductibles, and also from this self-funded community. They're flying people into Oklahoma City, not just to the Surgery Center of Oklahoma, but to other facilities here in the Oklahoma City area that have embraced the discipline and wisdom of these free market principles. Simply saying, here is what I do, and here's how much it is. That is my challenge, I think, to anyone who's watching this. I would encourage each and every one of you, rather than to say, I just want to practice medicine and I don't really want to have anything to do with the money, I would encourage you to think very differently. To make that statement really means I want to practice medicine and then I think abandon my patient to the wolves, to the corporate cronies who will get every dime from them that they have and then some, many times bankrupting them. I think it is not just our obligation, but really our duty to our patients to help them not only navigate their way through what their health needs are, but also through the finances, and we need to better understand that. I know I still have a lot to learn. If you will tell patients, this is what I do, and here's how much it is, you will be rewarded in ways that only I think the people here at the Surgery Center of Oklahoma and other facilities that have taken this step could tell you. One of the most exciting developments we've seen is these ideas to take place in primary care. The direct primary care practices are very exciting. The concierge and cash-only third-party free practices are very exciting. We have followed this model as well. And in fact, there are so many physicians and facilities in the United States now that are embracing this free market discipline that we formed an association called the Free Market Medical Association. It is not restricted to physicians and facilities. There are people from every component of the health industry that belong to this association, and I would encourage you to take a look as well. We are very excited to be part of this summit. I'm honored to be talking to you about our success here at the Surgery Center. This has been a very instructive, very educational journey for me as an anesthesiologist, and I thoroughly enjoy meeting all of the patients who come to see us from all over the country. We have been joined in this, what I call brotherhood of free marketeers from very, very unusual places. Even large hospitals with emergency rooms and intensive care units have joined us. Cardiac hospitals, orthopedic hospitals have joined us in this effort. Many of their lawyers have told them they can't post prices online, so I've put their prices on my website. This is an effort I think that we will all need to be working on very hard. I do not believe that there is an answer that will come from Washington, D.C. The government always screws things up, and I've always had a problem with repeal and replace, because that just means the central planners continue to be involved. I've often joked that repeal and replace should be repeal and acknowledge. And acknowledge that if you give an alcoholic vodka instead of gin, you're going to have the same result. Washington, D.C. should have nothing to do with healthcare. It is far too important of an industry to involve those who never get it right. I am starting to see physicians really reevaluate not just the place and legitimacy of government and healthcare, but the legitimacy of the state at all. And I encourage people to continue to think along those lines. I thank you very much for including me in this summit. We at the Surgery Center of Oklahoma are proud to be part of this free market movement, and we encourage any and all of you to join us. Thank you once again. Have a great summit.